on Friday. What should we expect next? Governor Abbott joining us live to answer our questions tonight. Governor, thanks for joining us. You've closed Texas bars and reduced capacity at our restaurants to 50% now. Are you planning more rollbacks? And if so, what will trigger those?
Well, what triggered the announcements you just mentioned was data. And so we look at the data. Obviously, we saw the incredible spike over the past couple of weeks, both in the number of people testing positive as well as the hospitalizations and the positivity rate that I told you in advance that if the positivity rate got over 10%, I was going to have to take action, and I did. So we will continue to follow the data. Importantly, part of the data that was revealed to us was the fact that so many people who were testing positive for COVID-19, they were contracting it in bar-type settings, and that's exactly why we had to take the action about bars that we did. So we will continue to follow data to find out where the settings may be that lead to people contracting COVID-19 to determine whether or not additional action needs to be taken. We also want to see the outcome of the shutdowns that were just announced. Hopefully, the announcements just made will be sufficient to begin to bend the curve of COVID-19. If not, we all need to understand additional actions will be necessary.
You touched on it there. The 7-day positivity rate is close to its all-time high now, nearly 14%. And the White House briefing on Friday called Texas numbers concerning. We've seen these hospitalizations and deaths increase, lag behind the positive test results because of the nature of the symptoms. So how concerned are you that there's a more serious spike to come?
So I'm very concerned. Actually, today's positivity rate is more than 14%. And so what this shows is it shows wider spread across the entire state of Texas. So your viewers need to understand that when they go out into the community, they really don't have any idea whether or not the person they are talking to or encountering does or does not have COVID. In fact, that person may not even know, because one thing that we've learned is the increased number of people who don't have symptoms who actually have COVID. That is why, Robert, one of the leading recommendations by medical doctors and medical studies is for people, when they do go out into settings where they will encounter others, the best thing they can do is to wear a mask.
Governor, we've reported hospitals nearing capacity now in Houston, and plans are in the works for an overflow site here in Austin. What role is the state playing in making those preparations for exceeding hospital capacity?
So the state will play an active role, like we did earlier this year, with regard to other locations around the state of Texas, to make sure all the resources will be available for any community that needs any type of overflow capacity. It could involve FEMA. It definitely will involve the Texas Division of Emergency Management, as well as DS, Department of State Health Services. All these alphabet soup agencies will be available to assist local communities. Now, that said, understand this, and that is our primary goal is to make sure that everybody who has COVID, it will have a hospital bed available for them, and that is exactly why one of my other executive orders last week was to ensure that by reducing non-essential surgical procedures, that should free up more hospital beds as well as ICU units for anybody who has COVID-19.
Let's talk about masks, Governor. The city of Round Rock passed an emergency ordinance just today under its city charter requiring anybody over the age of 10 to wear a mask when social distancing is not available. It's not only businesses but outside as well, and punishable by a $1,000 fine. You've been very clear that Texans will not be fined for wearing a mask. Does the city of Round Rock have the power to do this?
So I'm hearing what you're saying, and I just have to apply based upon what you've said, not what I've read. And that is that if it does impose a fine for people for not wearing a mask, that part seems like it would contradict my executive order without me having seen what you talk about. That said, I do want to applaud the city of Round Rock for stepping up and being one of the many communities across the state of Texas that has now imposed a mask requirement. Know this, now about 2/3 of the state is subject to these mandatory mask orders that have gone into place, like what you've seen in Austin and Travis County, and wearing those masks like that is one of the best strategies to prevent the spread of COVID-19.
Governor Greg Abbott, thanks for joining us here on KXAN. We appreciate it.
Thank you, Robert.
Will Dupree once again in the KXAN live studio. Thank you for joining us for that interview with Governor Greg Abbott. Very interesting to note there that he did say potentially other actions could be taken here in the state. if the coronavirus pandemic keeps getting worse. And the indications at this moment are that there may be more rollbacks at this point. He did point out that the positivity rate, so how many tests are coming back with positive test results for COVID-19, is going up. It's about 14% here in Texas at this point. And the governor said that because it went over 10, he took those actions, including closing all bars here in Texas and also rolling back restaurant capacity today to 50% all across the state. Also interesting to note that the governor said now two-thirds of the state, parts of it, two-thirds of the state have some sort of face requirement now enacted. That includes Austin and Travis County, and many other communities, particularly in Williamson County, are taking action today to require people to have masks on when they go into businesses. There are some that are taking stricter steps, so we have some breakdowns about that over on our website, KXAN.com, and the KXAN News app. Once again, I'm Will Dupree here in the KXAN Live studio. We do appreciate you all watching. Please stay with us as we keep covering the coronavirus outbreak here in the state. Everyone stay safe, stay healthy, and if at all possible, still at home.